Thank you so much. Good afternoon, everyone, and thanks for joining us today. My name is Katie Roan, and I am the Performance Standards Coordinator at the Office of Local and Regional Health. We're excited to have you with us today for today's session, From Survey to Solution, Turning Your Performance Standards Survey Results into Action. And I want to acknowledge that over the last several months, local public health entities across Massachusetts have dedicated significant time and effort to completing the Performance Standards Survey. Thank you all for your participation and commitment to this important work. Today's session is designed to be practical and action-oriented. While statewide results are still being finalized, municipalities already have access to their individual results and can begin using them to identify strengths, opportunities for improvement, and where additional support may be needed. Our goal is to help you understand what your results mean and how they can be used to support planning, prioritization, and decision-making within your municipality. We're also fortunate to be joined later today by an outstanding panel of subject matter experts who will share their perspectives and help answer some of the common questions municipalities may have as they begin reviewing their results. Next slide, please. Next slide. Before we get started, just a couple of housekeeping items to review. So first, this session is intended for local boards of health and local public health professionals. So if any members of the media have joined, we ask that they disconnect from the session at this time. Perfect. Next slide. Thank you. Oh, sorry, it was the last slide. Go back, please. Sorry. Just want to acknowledge that recording of the session is not permitted, but we will be recording the presentation portion of today's section for educational purposes, and then we'll share the recording and slides with you all following today's session. All right, back to the next slide. I also want to briefly note that the Massachusetts Department of Public Health contracts with MAHB to provide guidance and educational support to local boards of health and health departments. So any information shared during today's session is intended for educational purposes.
Okay? Yeah. I just want to hear what they're saying and what their tools are. The state did make some posters, and I ordered.
Thank you. Any information shared during today's session is intended for educational purposes only. It should not be construed as legal advice. So if you require legal guidance specific to your municipality, we encourage you to consult your own city or town attorney. Next slide, please. A few notes about today's format. So we'll be reserving questions and answers for the discussion panel or the discussion portion of today's session. We won't be taking questions during the presentation itself, so that we can make sure that we can record that part of the session. Once we reach the panel discussion, please feel free to use the chat to submit questions or comments for our panelists. If you experience any technical difficulties during today's session, like me, please email us at performancestandards@mass.gov. I apologize for my internet issues. But with that, we can jump into the presentation. So next slide, please. So today's session will be organized into four sections. First, we'll provide a brief overview of the Performance Standards Survey and its purpose. Then we'll walk through the structure of the survey results report and explain how to interpret that information included in your municipal results. We'll then transition into the panel discussion with the subject matter experts who will share practical strategies for using your results to support planning and prioritization. And then finally, we'll conclude by highlighting some additional training and technical assistance resources that are available to support you all in meeting the performance standards. Next slide, please. The purpose of today's session is threefold. First, we want to help you understand exactly what your performance standards survey results are measuring. Then we want to help you interpret your results by identifying both strengths and opportunities for growth. And then third, we want to demonstrate how municipalities can use these results to inform planning, training, budgeting, workforce development, and resource allocation decisions moving forward. The goal is for you all to leave today's session with a better understanding of how to translate survey results into meaningful action. So throughout today's presentation, we'll highlight several ways that municipalities can begin using their survey results immediately. So we can jump into that. Next slide, please. Next slide. So at its core, the Performance Standards Survey helps answer some fundamental questions. Are we meeting our required public health responsibilities today? And the survey was designed to help municipalities better understand statutory and regulatory requirements, identify barriers to implementation, and establish a baseline for future improvement. The results provide a clear picture of where capacity exists, where challenges remain, and where future investments in staffing, training, or resources may have the greatest impact. Ultimately, the survey is intended to serve as a roadmap for strengthening local public health over time. Next slide, please. Although statewide aggregate results are still being finalized, municipalities can begin using their individual results immediately. Your results can help you identify current capacity, available resources, and area where additional support may be needed. They can also help you prioritize where to focus your efforts, identify those training opportunities, and communicate public health needs to municipal leaders, boards, and community partners. Most importantly, your results can help support evidence-based decision-making as you begin planning for FY27. And these results are intended to guide that strategic action, not simply satisfy a reporting requirement. Next slide, please. And then just a quick note for municipalities participating in a shared service arrangement, we're also developing tools to support SSA level planning and implementation efforts. So the results summary for shared service arrangements is designed to accompany the municipal level performance standard survey results and will allow shared service arrangements to aggregate and review those results across participating municipalities. And this resource will help identify common strengths, challenges, and opportunities for collaboration across the municipalities. We'll provide an overview of this tool during the June 17th Public Health Excellence monthly meeting series, so please plan to join us for that. Next slide. All right, now that we've discussed why the survey matters and how the results can be used, I will pass it over to Kyla, who will walk us through the results in more detail.
Thank you, Katie. You can go to the next slide. Everyone who submitted a performance standards survey and completed the quality assurance phase received an email from the performance standards at mass.gov inbox with a link to access a summary of their performance standards survey results. The subject line on this email is Access Your SAFE 2.0 Performance Standards Survey Results Summary. If you were the person in your town to submit the performance standards survey and you have not received this email, please search your inbox for an email from performance standards at mass.gov, and you may have instructions to either access your results or engage in the quality assurance process. Next slide. Over the next few slides, we will review what is included in the results summary page. Next slide. So the results provide an overview of your local public health entity's reported progress towards meeting the Massachusetts performance standards for local public health, and it highlights the number of applicable performance standards that are currently being met based on your survey responses. The results page also highlights which questions received a no response, as well as the reasons identified for that no response. Next slide. As a disclaimer, all of the data that will be presented today is sample data and it is not associated with any municipality in Massachusetts. Next slide. The Performance Standards Survey and the Results Summary page are organized into 9 distinct topic areas that align with the statutory obligations of local public health in Massachusetts. First, the administrative section asks local public health about their governance and operations. Then the general environmental health, food, housing, waste, and water sections all ask about relevant topic-specific licensing, permitting, oversight, and inspections. The disease control and prevention section highlights public health nursing responsibilities as well as disease surveillance, reporting, and response. And the tobacco use prevention section asks about the licensing and regulation of tobacco establishments and tobacco control. Finally, the foundational public health services section of the survey covers the broad programs and skills that are needed in every community. But for the purposes of today's discussion, we will not be focusing on the foundational public health services results specifically. We recognize that achieving the FPHS is a long-term, stepwise process for Massachusetts local public health, and our goal is to first support municipalities in understanding and strengthening their ability to meet the performance standards. And we see this as an important foundational step towards the broader public health capacity building efforts, which will lead to the foundational public health services. You can go to the next slide. So the first data table that is shown in the results summary page presents the total number of questions that your municipality answered yes to, along with the percentage of applicable questions that were answered yes for each topic area and subtopic. So this table provides a high-level snapshot of the alignment with the performance standards across all applicable requirements for your municipality. Next slide. At the bottom of this first table, you will see the total number of questions answered yes, and the overall percentage of applicable questions that were answered yes. So for this example data set, there are 147 applicable performance standards questions, and this municipality answered yes to 123 or 84% of those questions. Next slide. Following the first summary table, the results page displays performance standards results by topic area. Topic-specific tables provide a more detailed breakdown by section by highlighting which questions received a no response and the reasons identified. This breakdown is intended to help identify potential areas for future focus and support ongoing efforts to strengthen capacity over time. For respondents who selected no, they were asked to identify the primary factor currently limiting their ability to meet the performance standard. And these no response options included more staff required, additional training required, lack of funding that is not staffing related, and lack of awareness of the specific performance standard. Next slide.
Watch your language, Connor.
So here is an example of what the topic-specific results will look like for a municipality. And you can see the total number of applicable questions at the top, followed by the number of questions answered yes. Below that, the table displays the total count of no answers categorized by the specific reasons selected. Below the table, there's a list of each performance standard question that the municipality answered no to beneath their selected reason for answering no. You can go to the next slide. Thank you. Following the breakdown of the performance standards results, you will see a budget and workforce summary table, which summarizes the budget information and staffing levels reported for your local public health entity. In the tables, blank cells indicate that a specific item does not apply to your municipality or district, or that no amount of money was entered. Next slide. Below the budget and workforce summary, there are two tables that provide a summary of the estimated establishments within your municipality, as well as the estimated number of permits and complaints your local public health entity will process during fiscal year 2026. Next slide. The final table in the results page provides an overall summary of results by topic area and response option group. For municipalities in a shared service arrangement, you're encouraged to use this table to complete the results summary for shared service arrangements, which we'll talk about more in the next slide and later this month. Next slide. So this resource shown here will be presented during the June 17th PHE monthly meeting series in more detail. And the results summary for shared service arrangement aims to accompany municipal level results from the performance standards survey. This resource can be used by shared service arrangements to compile multiple municipalities' results and identify strengths and areas of opportunity at the shared service arrangement level. And now I will pass it back over to Katie to facilitate the panel discussion. Thank you. Next slide.
Thank you. So before we begin the panel discussion, I just want to take a moment to introduce our panelists and thank them for sharing their time, expertise, and perspectives with us today. Next slide, please, Eileen. Thank you. So first we have Paul Hoffman, a longtime environmental health leader and consultant. Paul spent nearly 3 decades with the Massachusetts Department of Public Health, including serving as Assistant Director of the Community Sanitation Program from 2004 until 2021. Today, Paul continues to support local public health and serves as an MHOA subject matter expert. He also provides sanitary code training and supports the development of inspection software used by local public health professionals across the state through Hoffman Public Health Consulting. Next, we're joined by Robin Chappell, a highly respected local public health practitioner with extensive experience in environmental health, inspections, permitting, and regulatory enforcement. Through her work supporting municipalities across Massachusetts, Robin has also helped communities navigate complex public health challenges while strengthening local capacity and compliance. We also have Doug Kress, who served as Director of Health and Human Services for the City of Somerville from 2015 to 2022, where he led a successful reorganization and expansion of the department. Doug brings extensive experience in public administration, organizational leadership, strategic planning, and municipal operations, having previously held several leadership roles with the City of Minneapolis. And finally, we're joined by Chassie Robinson, a local public health nurse consultant with more than 20 years of public health nursing experience. Chassie has worked in communicable disease control and local public health departments across Massachusetts and co-founded the North Shore Mother Visiting Partnership, which provides home visiting services to new mothers. She brings a wealth of expertise in public health nursing, disease prevention, and community health. So please join me in welcoming our panelists. We're fortunate to have such a diverse group of experts with experience spanning environmental health, public health administration, workforce development, nursing, and regulatory compliance. And I'm looking forward to today's discussion. To help facilitate the discussion, I'll pass it over to Cassandra Anderson, Director of Performance Standards at OLRH. And I think we can probably stop recording at this time to allow for the panel.